I think it's really important to be able to have trust in the practitioner that you're working with, to know that they've received this training. So it's good to ask if your practitioner is wanting to touch, your body as part of your treatment plan. I think good things to ask are, tell me a little bit more about your training. When did you learn how to do this? You know, who is your teacher, or what other trainings have you taken? So if they are an SEP, if they have that credential, they will at least have had, again, a 6-day module within the 36 days of training that is solely devoted to touch. And again, that's what they do there in that training. It's a little bit of an overview. It's going to be focused on joints. It's going to be focused on holding the occipital area of the head, the viscera, perhaps touching other parts of the body, maybe the shoulders, the hips, kind of these areas that in the osteopathic tradition they call diaphragms. So again, they would at least have that amount of training if they have that SEP credential. But many of us, like myself, became very interested in touch because of the profound difference that it made either for ourselves and or what we saw in clients. So I've had, I think, at least 4 other touch trainings. There's one called TST, Touch Skills for Therapists, that's taught by Kathy Kane. That's, I think, if I remember right, 3-module training, and it just goes deeper into the anatomy of the body and how we can help support the client who has had different types of trauma, different types of experiences that affect different aspects of the anatomy. I've done Steve Terrell's TEB training, Transforming the Experience-Based Brain, learning how to do, it's kind of a deeper dive into touch-based attachment work, also working with primitive reflexes that often get stymied when there's developmental trauma in the earliest years of life. So, you'll want to ask the therapist or the practitioner, what trainings have they had? Sometimes they'll have, the certifications, or their certificates, I should say, on the wall. But it's important to know that they are trained in this, because they're going to be touching your body. And touch should always be done with a therapeutic purpose in mind. I shouldn't, as a practitioner, touch the body because it's like, well, I don't know what else to do. Rather, I'm touching the body at this place for this clinical reason. And typically it's about, again, bringing the nervous system of the client into regulation, as opposed to that stuckness or fixity that's in their nervous system. It's not flowing like it's supposed to. And again, touch is a very direct way of doing that, because we can do it with words, but often words take longer. Because I'm using this touch and it's nervous system to nervous system, it often can produce a faster result.